Um, So the Native Oral Health Network is a program that is housed and administered through the Southern Plains Tribal Health Board. The Southern Plains Tribal Health Board and the Oklahoma Area Tribal Epidemiology Center it's a nonprofit organization, and we're based in Oklahoma City, Oklahoma. The Health Board was established in 1972 to provide a unified voice on tribal public health needs and policy for the 44 federally recognized tribes in Oklahoma, Kansas, and Texas. And so that's our service region. And we align with the IHS service region just for uniformity. So it's the same service region, the Southern Plains, as the Indian Health Service. So the Native Oral Health Network, oh, sorry, next slide. So the Native Oral Health Network is funded by two main funding sources. One is a national initiative called Building Public Health Infrastructure in Tribal Communities to Accelerate Disease Prevention and Health Promotion in Indian Country, short TECFI, and that's what we'll call it from here on out. And that funding comes from the CDC. We have the Native Oral Health Network is a small project in this bigger funding source at the Southern Plains Tribal Health Board, and they're also placed at other health boards across the country in tribal epidemiology centers. The other one is a subaward that we get from the Oklahoma. Oh, okay. Corey is not seeing any of the slides. Can you guys, Jennifer, I'm going to call on you. Can you see the slides?
I can see the slides.
Okay, okay. Corey, I don't know why you might not be seeing in the slides. Alex, is there any way?
I can stop sharing and reshare it.
Okay. But through the Oklahoma Shared Clinical and Translational Resources, that's actually programmed through the University of Oklahoma Health Science Center. So through these two funding sources, it provides funding for two full-time staff, one of which is myself, and the other is Alex, who's on the call with us today as well and helping with the slides and taking notes for us. And then we also have another part-time that works about 10 hours a week. So okay, next slide. Glad you're all taken care of, Corey. Okay, so we I stole that from Frances Walsh from Open. I know she's not on here, but I wanted to give her credit for this term. But we also operate within Open, which is the Oral Health Progress and Equity Network. If any of you have been on any other webinars or any of our calls, you've heard me talk about Open. We could do a whole other presentation on everything that they're doing and all the awesome work that's happening through this network. Unfortunately, we don't have time to do that today, but I'm going to talk about two main areas that how we work through Open. And Open is a national network of a bunch of really awesome, inspiring oral health advocates that are doing a lot of great work. So within Open, they have what they call network response teams, or NRTs. And so the Native Oral Health Network operates as a network response team through the Open platform. And so what they really do is kind of what we do as a network anyways, which is we function as provide learning opportunities around different topics of interest. Just as for more context, some other NRTs within Open include a data NRT, LGBTQI+ NRT, Medicaid, adult dental benefits, learning collaborative, policy, public perception, and rural, and those are just a few. I also serve as the grassroots representative for Oklahoma through Open. And what I do in this role is serve as part of the formal leaders for Open and engage in activities and help to support the network as a formal leader. And we have a bunch of different activities that we do with that. Okay, next slide. So moving on to the actual, oh, and this picture is not coming up. Okay, that's okay. Here, let me, Alex, you want to stop sharing and I'll pull it up. I don't know why that's not. Okay. Can you see that now? Okay. Okay, so the Native Oral Health Network was formed from a need to authentically collaborate really in the Southern Plains area. And when I say that, I mean Oklahoma, Kansas, and Texas. So after needs assessments and conversations with tribal stakeholders, we realized we needed a way to support each other in this work. So the Southern Plains Tribal Health Board, absentee Shawnee tribe based out of Norman, which is, or not based out of Norman, in the Norman area, which is outside of Oklahoma City. Stakeholders from that tribe, Choctaw Nation, which is in Southeast Oklahoma, and the Dental Support Center director from IHS, and a few other people got together. And so we created this kind of infographic that really formed the basis of what this network will do and can do and have done to this point. So why are we coming together? What are some of our qualities? What do we actually do, and why are we doing it? That we kind of formed this this infographic. And so our creative team kind of facilitated this process in these kind of discovery meetings, as they called them. And so they provided a lot of guidance on the quote unquote brand that we were creating with the Native Oral Health Network. And so this was just part of us being really intentional about defining ourselves and defining the message and the platform that we were creating. So this is a picture of us in our very first kind of work group meeting. This was in 2018 at the Tribal Public Health Conference that we had in Oklahoma City. So we really got a lot of good information and a lot of good work that happened out of this meeting. So this is the framework that's really guided the creation of NOHN and the continued development. This is the stage 2. I want to say that it's been really important for us as a group, and me as the coordinator and leader of this group, to make sure that we are doing things and creating activities and creating products that are building trust in these communities, because that is first and foremost the most important thing that we need to do. And so we've stayed in this middle, in this stage 2 for a long time, because we have felt that in creating something new and trying to offer support and things of value to Native communities, it takes a long time to build those relationships, and it takes a long time to build that trust. And so this is something that we're constantly doing. This is a place that we're constantly checking in at to make sure that everything that we put out, that we are intentional, we are open, and the dialogue of how can we help, how can we do better, how can we continue to build that trust. So it's been the overlap where these two circles meet between identity and productive work has been something that we've really struggled with, because we've really been doing both of those at the same time has really driven myself crazy, because there has to be work in developing these core functions and core values and who we are and what we want to do, and what kind of resources can we put out and share, and how can we work together in identifying that and defining that, but then also having some level of output to kind of coincide with that. So it's really, really been difficult. But this has just been really helpful and really guided a lot of how we're going to operate. So this is NOHN's mission, and this is, we developed this in our strategic planning meeting that we had in 2019, and this was through a bunch of stakeholders and really absentee Shawnee tribe. Keisha Myrick, I don't know if she's on the call or not, with IHS, and Dr. Jana Winfrey. We had a really good core group of people that helped over a really, really long day define a lot of things. But building healthier Native communities by connecting oral health to overall health and wellness through peer support, collaboration, and community engagement. So we're going to look at what this looks like in action, specifically over the last year or two. This is a reminder to me to take a breath. So I'm going to take a deep breath. I'm going to imagine myself as this person right here, out by myself in the middle of this beautiful ocean. We're wanting to take a beach vacation so bad. This is just me kind of daydreaming at this point. Okay, so these are priorities that have been identified by tribal stakeholders, and this was feedback from 2018 and 2019. Networking opportunities, community engagement, education, providers wanting to talk across disciplines. We need more advocacy. We need technical assistance with grants, sponsorship, survey development, etc. So now we're going to look and see what we've done with this feedback and how we've been accountable to that. So our research and data collection. So these items are from 2018, over 2018 and to 2021. So first off, we've increased our oral health data collection through our tribal behavior risk factor. I missed surveillance in there. It should be tribal behavioral risk factor surveillance survey. So previously, I think there were only two oral health questions on this survey. And so we were able to add some questions. So I think we're up to 7. It's about I think it's a 60 question survey. So we're getting more information, and this tribal BRFIS survey is administered at community events, powwows, health fairs, etc. in Oklahoma, Kansas, and Texas in our service region. The other thing that we've done, or actually doing right now, is the Oral Health Challenges and Potential Solutions Survey. So this is for Oklahoma residents only, or if you work in Oklahoma. And so this survey is still open, and we are planning on doing analysis, and we'll have more information to share probably by the end of April, but this is something that's ongoing right now. Also, we collected a dentist to population ratio, and that data is something that's not readily available for our area. And so we went through an IRB process. We went through a bunch of different things to be able to collect this data. So this data in our methods is in our Indian Health Service Oklahoma City area oral health report, and I'm going to talk about that here in the next slide. And also just evaluation data from all of our meetings and different projects that we do that help inform this work. Okay, so the guides and publications that we've put together over from 2019 to current. So first, we did the resource guide. It was in 2019. We released that in 2019, and that has just kind of a slew of information. So it has a clinic directory, a tribal clinic directory. Excuse me, let me rephrase that. TTUs, which is tribal organizations, and urban clinics. So we have TTUs in the Oklahoma, Kansas, and Texas that offer dental services. So we updated all of that information, and so you can find the directory within the resource guide. We also have a bunch of helpful links to publicly available data sources around a bunch of different oral health measures. And so there's a bunch of different information that's just kind of a little bit of everything. And then in 2020, we partnered with, we worked with Oklahoma Dental Hygienists Association in putting together a resource guide for the dental office in regards to all of the updates and everything that was coming out when the COVID-19 pandemic happened. So what this particular document was just embedded links of information coming from credible sources and directories and stuff. So we put that together and sent that out to our network. And then the report that I mentioned on the previous slide. So the Oral Health Among Indian Health Service Oklahoma City area population. So what we did through this report, and we just finished this, and I will send this out to everyone once we're done with our call today. But what we did was we took a look at Oklahoma City area. Again, that's Oklahoma, Kansas, and Texas data, oral health data around, I think we have the GIPRA measure data, and then we also analyzed all of the IHS oral health survey data information. And we compared that data to IHS national and US general population over each oral health measure, each GIPRA measure. And then we also have the dentist to population ratio where we look at IHS overall. We look at Oklahoma, we look at the Oklahoma City area, and then we look at the national US general population. So all of that is in the report, and we have some supplement, that's a key takeaway sheet, because this report's about 36 pages. And so we wrote it from the perspective for a target audience of a general public health audience. So we didn't really write it for those that are dental professionals per se, and so there's not a lot of technical information in regards to oral health. The data is technical, but not when we're talking about dental decay, community water fluoridation, health provider shortage areas, and things like that. So we'll get that sent out after we wrap up, probably tomorrow, actually. Okay, so these are the formal presentations that we did, and these were all in 2020. So we presented on the Native Oral Health Network at the APHA annual conference, and I believe that was in October. And through this presentation, we partnered with the Great Lakes Intertribal Council, and that was based out of Wisconsin. And we also did a presentation to the Good Health and Wellness in Indian Country National Network of Grantees. So the Good Health and Wellness in Indian Country is a national initiative, and this program lives in the health boards and TECs across the nation. And so we presented to this national network call about the Native Oral Health Network. We also presented at the Oklahoma Public Health Association conference, and then coming up in June of this year, we'll be doing a presentation at the Oklahoma State Medical Association, and that's been facilitated through the absentee Shawnee tribe. So our education and outreach, and this is from 2020 and actually 2021 too. So back in May, we did a tribal oral health services during COVID-19 webinar. We brought in a few tribal stakeholders. Dr. Shelton Miller, I know she's on the call. She was one of our panelists, and Dr. Van Buskirk, which is out of Chickasaw Nation. I don't know if she's on the call. Anyways, it was a really great webinar to talk about infection control procedures, how some of the tribes are using teledentistry in the wake of COVID-19, and just kind of went through different procedures that are happening at all of the different clinics, because it didn't seem like there was very much uniformity. So this was really a way for clinics and for different tribal stakeholders to kind of talk about what they're doing and share that information. We did a dental directors listening session, which was with the dental directors in Oklahoma, that talked about some of the issues that they were having during COVID-19 and how we could facilitate or support them, and really how they could learn from one another with all the barriers that they were facing. And then we actually just wrapped up our dental health aid therapy learning series. So this was 3 webinars that we did, and this particular series was is being funded through the National Indian Health Board, and the funding opportunity is Tribes and Tribal Organization Education Outreach Programs for dental health aid therapy. And so our last webinar wrapped, I believe, in January. January. All the recordings can be found there, and I think Alex is going to put the link. We have all those on our webpage, so you can go back and watch those if you didn't get a chance to join us live. And then the other is the Oklahoma Oral Health Coalition, which is a statewide coalition. We are doing the Raising the Grade on Oral Health in Oklahoma webinar series. You can find information on the website there, but we've been help facilitating that process. I'll be talking on the workforce webinar that will happen in April. And this is all stemming from the report card that they put out talking about oral health, our oral health grade, which we got a D in oral health over, I think it was 13 indicators. Okay, I want to take just a pause and see, I know I've kind of been talking. Is there any questions or anything up to this point before we move on to advocacy?
Wow, like Julie, remember what was it, like a year and a half ago, we were sitting at a restaurant in Baltimore and you were just penciling all this out, and yeah, like you're killing it. Like
it's a lot. It's a lot. We've done a lot, and like I said, we haven't done a good job of communicating all the stuff that we're doing. And so again, this is the whole point, is like, hey, let's all kind of get on the same page and figure out how we can get more people involved in this and get more people's perspective on what we're doing and how we can do things better or more efficiently, really. So thank you for that feedback. Okay, so I am going to move on. So I wanted to leave about 20 minutes for you guys to kind of talk and kind of have some discussion time. So I've got about 10 more minutes and I think I can do it. Okay. So the advocacy piece that we're also trying to focus on is we participated in an open virtual Hill Day, and that was actually last month. And so through this event, and I again, that could have its own presentation in and of itself. But this was a great opportunity for us to talk to our congressional delegation about oral health and how we need more funding for oral health infrastructure, and we need oral health included in health policies. You know, we talk about how oral health is connected to overall health, and there's science, there's data to support that, but we need oral health in all health policies. So that's something that we're really focusing on, that was a great opportunity that was facilitated beautifully by Open to be able to have those conversations. And then also dental health aid therapy. You know, we're taking some time to educate tribal leadership and stakeholders in Oklahoma about this model and how it's worked in other tribal communities, and you know, the potential for it to help in Oklahoma. Okay, so this is from year one successes. So this is highlighting our work from 2018 to 2019. And so we had 83 members, and this is from Oklahoma, Kansas, and Texas. So this is still our service region. We had 31 different types of expertise that are collaborating. We had 13 state, community, tribal, and urban Indian organizations in 7 tribal nations that were a part of our network from 2018 to 2019. Excuse me. And then this is our year 2. And when I say year 2, this is kind of our funding year. And so this is data from 2019 to 2020. And so now we have members that are represent 11 states, We have a total, I even think it's more than that now, 121 members. We have 48 different organizations that are represented in this 121 plus members, 47 different types of expertise. We've 140% increase since we started this in year one. And we have, in 2020, we held 10 network-wide meetings, 4 trainings, and we trained 169 members or participants. So we've definitely had some growing pains throughout all this, and I think it goes back to, you know, where those in our framework where those two identity and productive work overlap, and I think a lot of that because we're focused on in outputs and what we're putting out to keep the Native Oral Health Network and the things that we're doing, and to keep it in not front of mind, but to keep it on people's radars, but also still trying to develop the infrastructure and processes and things like that. That's been difficult. So we really need to focus on what really defines a member and what does that look like? How do we engage members? Well, once we have that definition, how do we engage in various projects? You know, as always, it's like there's so much to do, so little time, money, and staff and support. And we also, you know, we need to create process efficiency so we can focus on the productive work. And I think Alex has done a fantastic job of really helping out in helping us to refine those efficiencies. And how do we make the work more inclusive and applicable beyond our service region? You know, a lot of the data and a lot of things that we're doing is specific to our area, but we want to be able to provide resources to you all that are in the other states that our membership represents. And so how do we do that? And that's always been something that we're trying to figure out. This is also a reminder for me to take a breath and take a drink of water, so I'm going to do that. So now, where are we heading? So I want to kind of talk about briefly about the things that we have on deck and things that we're kind of currently working on, other than kind of things that are continuous. So we're about to start a American Indian Alaska Native Workforce Project, and this is being funded through OSCTR. And so this is going to entail a systematic literature review to evaluate and analyze publications on workforce diversity in oral health, or I should say lack thereof, but specifically as it relates to Native communities. And we have released our oral health report, but we really want to be thoughtful and deliberate on how we engage with stakeholders on this report. So we don't want to just give people a bunch of data and say, here, you know, figure out how you want to use it. We don't want it to collect dust on someone's desk or, you know, sit in someone's inbox. We want to be able to operationalize it or create some action around it. So we're currently in the middle of that process. We also plan on at some point creating a known member guide. We need to update our strategic plan. And then we've heard a lot of feedback about having, you know, the Native Oral Health Network holding a summit. And so we'll see where that goes. So this is kind of how we've operated, and please forgive my really cheesy diagrams and PowerPoint slides. So really we've had our staff, which, you know, when we first started the Native Oral Health Network, it was just me, and then we've added on Alex full-time and then Amanda part-time. So we've had our staff, which I said is us 3, and then we've kind of had these ad hoc committees, right? So we've had our core group that have been absolutely fantastic. And I'm going to call out Dr. Shelton Miller, and I'm going to call out Jamie Roel, and I'm going to call out Keisha Myrick, and I don't know if Dr. Winfrey is on here, but you guys have been, I mean, that they have been at the core and really helped to get this stuff off the ground. So again, thank you for all the support then and now. And so they've really been these ad hoc committees. And so when different projects have come up, hey, we take a look at this, give me some feedback. Hey, what do we need to do? Dr. Miller was like, we need to do this dental director listening session. So let's put this together. Okay, so that's kind of how we've operated, and it's worked really well for us. So this is, if you guys are familiar with communities of practice and kind of that term, this is from that framework. This is actually from wingertrainer.com. And so this is how they kind of define members and participation in community of practices. And we kind of started out as a community of practice, and in a lot of ways we still are. But this is kind of how we've defined a member, coordinator and core group kind of at the center. Then you have different types of participation. You have different types of members. And so we've kind of used a mashup of frameworks, but we've leaned more heavily on this one. And okay, so this is kind of what I've kind of envisioned us, or this isn't anything groundbreaking, but this is just kind of to help visualize more of high level of where we're going in oversight and kind of general operation. So we're currently refiguring our steering committee, and we're wanting to make it more diverse and inclusive of these other areas. So we're still looking for a couple of members, specifically from the Northwest and the Southwest region, to serve on our steering committee. And so they will continue to be at kind of the center, kind of in that core region. We get support from Open and their infrastructure and their platform and those things. So this, and then obviously the health board staff will kind of stay in the middle and help to kind of keep things moving. But really all of these rectangles should kind of overlap, but because they do overlap, a lot of these projects overlap, but this just kind of takes all the things that we're doing and take a few steps back and really look at those areas that we're touching on. I know with like the community of practice portion of it and like the learning community, I think we're going to partner with the Good Health and Wellness in Indian Country team at the Southern Plains Tribal Health Board to do a cultural humility and traditional knowledge series. So I'm really excited about that. And then we have a few other things that have been requested from evaluations that we've had. But, I would like my vision is to really have someone kind of lead these different areas and help kind of feed different ideas and ways that we can operate in these areas. So I'm kind of a visual person, so this kind of helps to help me figure out really what we need and what might be beneficial. Okay, so I have 11:38. So this is a lot of information. It's a lot to take in. I want to just take a little, I'm going to stop sharing my screen for just a second and stop share. Yes, and Monica McKee. Oh my gosh, Monica has been fantastic. Thank you, Dr. Miller. I'm sorry, Monica. I didn't mean to leave you out, but you've been such a big support in all of this. But I wanted to take a second to see if there are any questions, any thoughts on kind of all of the brained up of information that we just talked about. Then I have some discussion questions that I want to kind of pose to the group. No questions? I know I wasn't that clear. And feel free to put them in the chat box if you don't want to unmute yourself.
Julie,
Hey, Dr. Miller, yeah.
it's you look at all of this and you see how far we've come. One of the things I'd like to point out to everyone that's here today is that one of the things we wanted to accomplish is to really look at doing some partnerships and kind of collaborating with other organizations and maybe some other disciplines. And, despite COVID, we really have done that. We've done quite a bit. Imagine had we not had, an unusual year where we would be. But I think we've shed a lot of light on the needs in Indian country. And, our overall goal is to continue that and improve things. So hopefully everyone that's on the call today will really jump on board and help us kind of move this across, not just the state of Oklahoma, but throughout the United States. It's kind of where we're trying to go with all of this. So I'm excited.
Thanks, Dr. Miller. Yeah, and you bring up a good point, because that's one of the things that's the feedback that we've heard, is that we need to bring in other disciplines to have that voice at the table. So thanks for bringing that up. And so maybe to kind of help spark some discussion and feedback and ideas from you all, because again, like I had mentioned, we need to do a better job of, instead of like once every 2 years or once a year, like, hey, here's all the things that we're working on, and to be able to update the larger network and get more people involved in what we're doing to add to that perspective. So let me see, let me pull up my questions. So this is, these are some initial questions. These are just kind of all over the place, but these are the questions that I ask myself, and when doing this work is, how is this of value to you? Is it valuable? How is it valuable? Can we make it more valuable? Can we create something that that supports you and your work in Indian country? And what are some strategies to expand this work? We have some high-level concepts and high-level areas, but what does that really look like? And again, how can we reach other areas, and how can we make that more applicable to other regions and other Native communities outside, here within the Southern Plains area? What do you want to see more or less of? Do we need more, do we need more resources that can be handed out? Do we need more just time to network? Maybe we need more meetings where we have some time to like meet and hear from, maybe we just have like just an hour where the network gets together and we just kind of talk about what we're doing and what space we're working in. And and that's part of like, how can we connect more authentically? And after hearing all of this, is anyone interested in kind of leading and taking a certain area and being more involved within the network with kind of providing more ideas and thoughts? And again, I think it's important to know that you always have different, you have different types of members, right? You have the ones that want to get in there, that want to do the work, and then you have members that like to just that would, I think that diagram was more kind of peripheral, where it's like, okay, I just want to meet and see what's going on. just kind of take it all in, provide some feedback here and there, and that's fine too. It's all great, but we wanted to have this opportunity to be able to put all of the opportunities out on the table. But I think, if we only have time to maybe get to one of these questions, because I know these are kind of all loaded, but how often, is this a call like this? These R&R calls, are these helpful? And is this a good way to update everyone on the resources that we have available, our progress as a network, and different opportunities? And maybe that's where we start with the discussion is how often are these calls helpful? And before we go into discussion, I'll say that our steering committee will be meeting quarterly. And so we could also kind of maybe stagger those meetings, but I'm going to just pause for a second and see if anyone has anything, if this sparks any other questions or discussion, or if we want to just kind of talk about this call and how we want to move forward. Not everyone at once. Would these kind of update calls be helpful, once a quarter? Or is once a year okay? That's fine. Was this not long enough? Do we need more time for networking? And it's okay if we don't know. I know, again, it's a lot of information. Sometimes for me, I know it's all the information and the feedback and the questions come after the call's over with, sometimes a day or two, but anyone have any thoughts?
Hey, Julie, from Arizona, I know you've kind of watched us sort of struggle to get somebody engaged that can stay engaged at NAC. We've had some turnover on the staff position, and then not being able to add it to some of our partner connections. But we're going to go through a hiring process again, and I'm hoping we can get somebody. But this was good. I need the nudge. Like something like this makes me show up, because I know I can get all the information, and I'm taking notes and going, oh, we need to check on this. Oh, we need to get back on this kind of thing. So quarterly, maybe semi-annually is a good thing for me, because it makes me realize what's going on. If I can get staffed, then I would engage that person into a work group, get them into a group. But until then, quarterly or semi would be super helpful.
Okay, thanks for that, Jennifer. I appreciate that. That's kind of what I was thinking. It's when we first started out, and put out a big survey of like, okay, how often do you want to meet? And I know everyone is inundated with Zoom calls and meetings right now, and everyone's kind of in 5 places at once. So like, how do we kind of find that sweet spot where we're not adding to the craziness, but everyone still stays informed, and there's still that opportunity to to join in and engage. So that makes a lot of sense. And I think, there's a difference in putting out the work and having products and being productive and having all of these things and products to show for what we're doing and how we're engaging and kind of answering the call to the needs. But again, we don't want to do the work just for the sake of doing the work. I think we want to make sure that again, that this that these products and these things that we're putting out and the opportunities that we're providing for everyone working in this space that are truly valuable, because again, you know, time is precious, and again, everyone, like I said, is everyone's kind of pulled in different directions. So it's always important to make sure that we're not just filling time and space. So from the chat box, it seems like everyone kind of thinks like quarterly, maybe like a quarterly reflect and regroup call like this would be good. Maybe like a longer quarterly meeting. So yeah, so maybe just providing a little bit more time versus an hour. I know we're kind of jammed a lot in I'm actually kind of impressed that I actually did that in 40 minutes. I didn't think I was going to be able to, but yeah, so maybe like an hour and a half. Yeah, I like that. Okay, yeah, Jennifer said one group I'm involved in with has networking scheduling for the first half of the meeting, and then everyone knows the content will start after. Yeah, I like that too. I know the statewide coalition meetings, we flip-flop. So we do the business meeting, and then we usually have about 15 or 20 minutes after to kind of network. So maybe we'll build in some networking time to these meetings. April, we have spent the last 10 years working in access in general and just now starting to dive deeper into specific populations. So I don't have any input, but this has been valuable. Thanks, April, for providing that feedback. I really appreciate that. Okay. All right, so I have 11:51, just a couple of things as we kind of wrap up. We will send out notes. I don't know if these slides would be helpful because they're kind of all over the place. If they would be helpful for me to attach with the recording, I can definitely do that. But we'll also be sending out an evaluation, and we might include, if you guys are okay, we might include some of these questions, not all of them, but just at least give you guys an opportunity if something comes of mind of maybe a particular topic for our learning series that would be helpful for you guys, products or data that would be helpful, or anything in general. We might just kind of give that space for you guys to provide that feedback there. So some dates to keep in mind, and some links. Oh, wait, yeah. Okay, sorry, I'm looking at a different slide. Okay, some important dates. So we have our Tribal Public Health Conference that's coming up April 20th through the 22nd, and that's going to be virtual. And there are two oral health breakouts that we're doing. One that's kind of specific to Oklahoma, but then we're also going to be, I mentioned our DHAT work, and we have a work group that that's doing some activities. And so during one of those breakout sessions, we'll have our DHAT work group present some of our work and talk a little bit more about dental health aid therapy. Open Academy is June 21 through 25. You can find more information about that on their website, in which I think Alex put in the chat box. The national meeting is going to be October 19th through the 22nd. So just mark these. These are great, really, really great events, and really encourage you guys to get involved with that as well. Okay, so next steps. If you are not a member and you want to kind of be included in we send out all the resources and meeting updates and things like that through our listserv. So you can fill out that link, and it's just some contact information. Again, it's no cost to join or anything. There's no strings attached. It really just kind of gets you included and put into the loop of what's going on. Here's the link to open where you can find more information about that. If you're not a part of that group, again, it's kind of the same thing. There's no there's no cost to join. It's just kind of a learning community. There's ways you can get involved or not involved, and so there's just a ton of resources. So you can join through the link, the link with the first bullet. The second one is the engagement platform, which is open communities. And there's all different subject areas that you can get information or get involved in, data and measurement, public perception rule, and then we have our forum, the Native Rural Health Network forum there, health equity. So there's a bunch of different things that you can do there. And then we're trying to do the social media thing, and Alex is doing a fantastic job. And so we're trying to engage people there. So you can, those are our Facebook and Twitter handles. They're listed there, and she can put those. Okay, awesome. Thanks, Alex. Okay, so I have 11:55. Thank you guys so much for your time and attention. If you, like I said, this recording will probably be out maybe tomorrow, probably not tomorrow. I'm going to say Monday just to give me a little bit more grace there. So we'll have the recording, and I'll attach the slides as well. If anything comes up between now or whenever, just feel free to send me an email. Any questions, always love to hear from you guys. So again, thanks so much.
Thanks, Julie.
Thanks, Jennifer. Good to see you. Tell everyone there hi.
I will. Hopefully we see each other like 2022.
I know. I asked Francis, the national meeting is that going to be in person or virtual? And so they said they're thinking about doing it hybrid. So.
Oh, cool.
Yeah. So
yeah.
I don't know. Well,
like I'm getting a little bit more comfortable with being on a plane. It would, and I really miss being in DC. Like I'd love to get to DC. So I wouldn't mind, I don't necessarily want to sit in a ballroom with 400 people.
Yeah, I know.
But a ballroom with 50, 60, 75 people, I could do that. So